Hi everyone, Dr. Obi from Pain Free and Fit and Posture Size. Today we've got a great lesson on how to train your shoulders working out with degenerative disc disease to avoid irritating your low back. Hope you enjoy. So if you have degenerative disc disease, herniated discs, bulging discs, and you still want a great shoulder workout, there are some techniques that you can use that are going to stress the shoulder joint greatly. You can use them even up to competitive levels of bodybuilding if you want to, without aggravating your lower back. Tip number one, when doing shoulder presses, if we use behind the neck bar shoulder presses, the tendency is to lean the head forward. When we lean the head forward, we also have a tendency to lean the lower body or the core slightly forward. The discs being in the front of the spine are more likely to compress with that weight going overhead if we're pressing from behind the neck. Conversely, if we're pressing from the front of our body, more of a conventional military press, that's going to create a slight spinal extension as the weight gets heavy. And for a lot of people with disc problems, extension is going to be our safer way of moving because if it's avoiding the compression on the front portion of the disc. So use a more low load forward motion with a bar, and it's better to use a bar with a slow cadence, meaning you're going to go up very slowly, 3-second, 5-second, even 10-second concentric and slow eccentrics. That's going to allow you to use less weight. Less weight means less vertical compression on your disc, still get a great shoulder workout. Alternatively, you can use a dumbbell, one-sided at a time. As opposed to the disc compression with a heavy barbell, it's going to be a lot less weight, but still very intense on the shoulder workout to use a dumbbell. When using a dumbbell, it's good to use a split stance with one leg forward and one leg back. That gives your spine more stability as you're pressing overhead. For those who have disc problems and are aggravated by both flexion and extension, using a split stance allows us to be a bit more secure in an AP or antero-posterior way, front to back, so that as we're pushing overhead, either with a supinated grip coming back, a neutral grip with the palm facing in, or a forward pronated grip, pushing that dumbbell up, we're a lot less likely to use flexion and extension or forward and backward movement. The leg spread is going to keep us stable in that motion. If we are doing a shoulder press from a seated position, sitting, of course, increases disc pressure up to 13 times sometimes. So if you're pressing overhead either with a bar or dumbbells, you're going to be a lot more likely to aggravate your disc seated than you are standing. Or an alternative is using a high incline chest press where you're creating tension on the anterior delt, the middle delt to some degree, the higher the incline goes, but you're allowing the weight that's transmitted through your arms to hit your upper back on the bench so that you're not aggravating your disc. Your lower back is in a safer position, still getting a great shoulder workout. Lateral raises. Many people in upright rows. If you're using heavy barbell upright rows to come up for shoulders, again, that's a vertical compression on your discs. Many times it's going to aggravate lower back disc problems, including degenerative, herniated, and bulging discs. As opposed to using a barbell, switch to a dumbbell, one arm at a time, and use a wide lateral stance. This gives you more stability. A narrow stance, there's less stability. The spine's going to be a bit more likely to move. If you have a disc herniation on one side or another, more likely to compress or overstretch that. With a wide base, it gives you more stability side to side, so that as you do either an upright row or a lateral raise, you have that stability and the spine can stay in a more neutral upright position, sparing it from aggravating forces that get you off your neutral spine position. If you don't know what your neutral spine is, check out our free body analysis on either the Posture Size or painfreeandfit.com website. We've got a free body analysis. Check out what the mechanics are and what your posture issues are and stability muscle issues are of your lower back. All of us with degenerative disc problems have some type of faulty mechanics or posture that's affecting the stresses that go into our degenerative disc. If you learn how to hold your pelvis, your hips, your rib cage, your stabilizing muscles like multifidus, transverse abdominis, obliques, a certain unique way for your body that matches your unique issues, it's going to hold your spine in a neutral position, a safe position for any of these exercises. If you don't know what a neutral spine is for you particular, not just a generic neutral spine that people try to teach, that most of the time is a waste of time, unless you know what your unique posture corrections are to hold yourself in a neutral spine, any of these exercises can always hurt your lower back. You're a lot less likely to irritate yourself if you keep your spine in a neutral spine position with the correct muscle tensions for your unique mechanical posture and movement tendency issues. So getting back to lateral raises, another way to work with these is laying down. This is a great way to bomb the shoulders in terms of intensity but spare the lower back. And it's sideline work. We can do lateral raises with the body in a sideline position that puts a lot less stress on the back. The back's in a neutral sideline position. The shoulder's still working hard with these lateral raises. As the weight gets heavier, it's going to be working the core because you're going to be resisting the tendency to rotate forward and back. You can help that by placing one foot forward on the floor. That'll give you a little bit more stability so you don't roll, thus protecting the back. You can also do side presses from this position, which are straight up and down. Great shoulder exercise if you've never tried it. Again, as the weight gets heavier, you can use more of a split stance with sideline so that as you're pressing straight up and down, the low back's in a neutral position, taking a lot of pressure off of it. These are techniques that I've used with myself when I was a competitive natural bodybuilder. Got me back to the stage and winning medals and trophies when the doctors told me I couldn't train with my lower back degenerative disc problems. I've helped a lot of patients and bodybuilders, powerlifters, general fitness people over the years with these techniques, and they're great for reducing back stress, but still allowing a great stimulus for shoulder training. One final thought with shoulder training is front delt work and rear delt work. A lot of people who do front delt raises, as they come up, they'll have a tendency to extend the spine. They're going to use momentum to bring the torso in with the arm. Locking down the abdominals to prevent that is one technique, but another technique is using that split stance again. When I put one leg back as I come up, my back leg is going to act as a strut that's going to prevent my back from arching and moving backwards, allowing me to target the muscles in the anterior delt region. Same thing with curls. If you're looking to curl heavy and you have your feet together, there's going to be a lot more tendency to extend the spine with either dumbbell or barbell or cable, low cable apparatus. Use a split stance, use your abs to contract, holding your body in neutral position, a lot easier to take pressure off the back. And finally, for rear delt work, a lot of people that want to hit their rear delts use bent over rear delt raises, reverse flies for rear delts. Great exercise to avoid this is using a prone bench rear delt raise, where as you're lying face down on the bench, you're performing rear delt raises. This takes the pressure off the spine. You can use this for rear delt raises as well as rows with a barbell or dumbbell to prevent that forward pressure on the spine that's associated with bent over rows and regular rear delt raises. If you like these tips on shoulder training for degenerative disc disease, check out our painfreeandfit.com's Fast Track program for degenerative disc disease. It's a program that's designed to teach you what your neutral spine position is, how to analyze your mechanics, your unique muscle imbalances that affect your degenerative disc in your lower back, learning how to set a neutral spine, proper core training, and then how to implement that in a general fitness, including working out for your whole body, not just shoulders. That's available at the painfreeandfit.com website. Again, if you'd like to help me share this valuable information with other people with degenerative disc disease, give me a thumbs up below. Questions or comments, write in. I'll do my best to answer them. And as always, if you have any questions that are more than general and you need to consult with me online, feel free to contact me through the painfreeandfit.com website. We can get together, you and me, on a video consult and design a personalized program for your degenerative disc problems that keeps you in great shape without aggravating your lower back. I hope these tips on shoulder training for degenerative disc disease helps you with your chronic lower back degenerative disc condition.